Cardiac axis. How to identify? To identify cardiac axis in ECG, check QRS deflection in lead 1 and lead AVF. Different types of QRS deflections. Positive QRS deflection, here R wave in QRS complex is bigger in size than S wave. Negative QRS deflection, here S wave in QRS complex is bigger in size than R wave. Equiphasic QRS deflection, here in QRS complex, the R wave size is nearly equals to S wave. It is mostly useful in identifying indeterminate axis, where lead 1, lead 2 and lead AVF shows equiphasic QRS complexes.
The most efficient way to estimate axis is to look at lead 1 and lead AVF. Then examine the QRS complex in each lead and determine if it is positive, equiphasic or negative. If QRS complex is positive in both lead 1 and lead AVF, it is normal axis. If QRS complex positive in lead 1 and negative in lead AVF, it is left axis deviation. If QRS complex negative in lead 1 and positive in lead AVF, it is right axis deviation, and if QRS complex is negative in both lead 1 and lead AVF, it is extreme axis deviation. Easiest way to remember it, check lead 1 and lead AVF. If both are positive, it's normal axis deviation. If QRS complex is negative in both lead 1 and lead AVF, it's called extreme axis deviation. This is ECG showing ventricular tachycardia. Here the QRS complex in both lead 1 and lead AVF is negative. Indicate extreme axis deviation. In right axis deviation, the QRS complex in lead 1 is negative and QRS complex in lead AVF is positive. Remember mnemonic right reaches. Let's understand it. In this picture you can see, if we kept lead AVF exactly under lead 1, it looks like that both QRS complex are approaching or reaching each other. That's why we can remember it as right reaches. In left axis deviation, lead 1 QRS is positive and lead AVF QRS is negative. Remember mnemonic left leads. If we keep lead AVF just below lead 1, if QRS deflection is going away from each other or leaving each other, it's left axis deviation. We can remember it as left leads. That is, in left axis deviation, QRS axis in lead 1 and lead AVF leaves each other. This is the example of left axis deviation. This picture shows all axis deviation with QRS deflection in lead 1 and lead AVF. Now at the end, we will go through common causes of axis deviation. Causes of left axis deviation includes left ventricular hypertrophy, left anterior fascicular block, inferior myocardial infarction, Wolff-Parkinson-White or WPW syndrome, and ventricular tachycardia. Causes of right axis deviation includes right ventricular hypertrophy, left posterior fascicular block, lateral myocardial infarction, WPW syndrome and dextrocardia. Causes of extreme right axis deviation. Uncommon due to clinical cause, mostly due to misplacement of ECG electrodes. If it is present, first check limb electrode placement. If electrode placement is right, then possible causes includes ventricular tachycardia with extreme axis shift and ventricular pacing. I hope this video will help medical students to identify the cardiac axis quickly. Thanks for watching. Do not forget to subscribe the channel.